at the Jesse Rogers, the hashtag to use is KTN Prime, and we'll be sampling your feedback during this live broadcast. Now, staying with health, the Kenyan Medical Practitioners, Pharmacists and Dentists Union, KMPDU, has threatened to go on strike, citing non-implementation of agreements with both the national and county governments.
The medics are unhappy over unpaid salaries, lack of medical cover, and lack of posting of medical interns, some of whom have been outside work for close to a year after graduating. Our health and science reporter, Chebet Birir, has more.
Some of the unmet medics' demands include non-posting of medical interns for almost 1 year now.
If you don't have a license, we are not allowed to practice because that would be a form of malpractice. You could even go to jail. So it's sad that on the other hand, the patients are suffering. On the other hand, the doctors are actually suffering.
According to the KMPDU Secretary General, Dr. Davji Atela, doctors are operating without comprehensive medical cover.
We have another doctor again who is currently admitted in ICU in KNH. This doctor was to be discharged for home-based care. But again, we have to do another contributions. So yeah, we keep on wondering, who is SHA covering?
KMPDU says that the government has failed to implement the 2017 collective bargaining agreement. The medics insist that the medical interns must be paid a gross salary of 206,000 Kenyan shillings as agreed upon in the 2017 CBA.
We cannot sit down to negotiate for interns when consultants are not being negotiated for. We cannot sit down to negotiate for pharmacists when the interns are out. We cannot sit down to negotiate for medical officers when we leave the interns out.
At the same time, UHC staff who were hired during the COVID-19 pandemic in 2020 were also on the streets to demand their absorption into the healthcare workforce as permanent and pensionable employees.
Kuna kitu inaitwa gratuity. Tumeweza kuhudumu katika kandarasi kwa muda wa miaka 5 kwa sasa. Kandarasi za kwanza ziliweza kuisha mnamo wa mwaka wa 2023, tukaweza kurenew. Sasa tunataka hiyo gratuity ambayo tuliweza kuhudumu katika kandarasi ya kwanza.
They were sent to public hospitals in the 47 counties to help COVID-19 patients with the promise that they would be hired on permanent and pensionable terms.
Article 41 of the Constitution, Labor, demands that no healthcare worker should serve on unequal terms and conditions because we go to work, same working environment, same working hours, but we get half salary. We are also on a contract that has extended for 5 years.
During a meeting between the Senate Health Committee and Health CS Deborah Baraza earlier today, the chairperson Jackson Mandago revealed that the Ministry of Health intends to hire 20,000 more healthcare workers, with the ministry being allocated 118 billion shillings for the financial year 2024 to 2025. It was alleged that 1.4 billion shillings was used to confirm UHC workers who are working under the national government, leaving those under county governments.
The consultations are ongoing among the stakeholders, that is Ministry of Health, COG, PSC and National Treasury, with respect to agreeing on the modalities of transitioning of UHC staff. The available budget allocation is 4.2 billion, which is sufficient to pay UHC staff at the current contract rates.
Chebet Birir, KTN, Nairobi.
Well, remember, we'll be reviewing KMPDU's ultimatum as of 10